Opening up in China, the virus's first epicenter, means 4 people in a noodle shop of 50. It means everyone in masks, everyone in gloves, constant social distancing, constant testing, temperature checks, contact tracing. That's what normal in China looks like. We cannot go back to normal until we have a vaccine. There is no business as usual. Things will change. Just today, the New York Times reported on new federal projections showing a spike in infections if shelter-in-place orders are lifted too quickly. Those projections were basically leaked to the Times, it appears, from inside the Trump administration. They totally undercut the president's stated wish to open the country quickly. Quote, if the administration lifts the 30-day stay-at-home orders, the death total is estimated to reach 200,000, even if schools remain closed until summer. 25% of the country continues to work from home, and some social distancing continues. I want to turn now to someone who has a plan for what to do when we reach that point. NYU professor, Nobel Prize-winning economist Paul Romer, who argues that we will need to test people on a massive scale. Millions of Americans getting tests every single day. Professor Romer, I've read some of what you've written on this, and I actually find it persuasive. But take me to the thinking of why you see testing and testing at a level that essentially no one has done yet as the key here.
Yep. Every single strategy for containing this pandemic requires that we take about 70% of the people who are currently infected, including the ones who don't show any symptoms. We take about 70% of them and isolate them. So if you got 100 infected today, if we did nothing, they'd have 250 infected people in 2 weeks. But if you take 70 of them and put them in isolation, only the remaining 30 become 75 people. So 100 now translates into 75 in 2 weeks.
Right.
And then the pandemic goes away. That's all there is to this. But it's hard. And right now, the way we're getting 70% of the infected in quarantine when we don't know who's infected is we just put everybody in quarantine. So the alternative would be to start to collect the information with the tests. We've got these tests. Collect the information, find out who's infected, and then put them in quarantine. Now, the reason Ezra, who I've talked to, says this is scary is this would involve a massive increase in our ability to test. We can do about 100,000 tests a day right now. We need to get up to 20 to 30 million tests a day. But the point is that this doesn't involve anything new.
20 to 30 million. 20 to 30 million. That's an enormous orders of magnitude scale increase.
Yeah. But look, this is a huge economy. We got 330 million people. We can do those big things if we just put our minds to it. And we don't have to invent anything new. And I think one of the reasons people get nervous when I talk about this is they think I'm saying, well, just everybody go back to work and we'll start investing in testing and we'll get there. You can't do it that way. You got to start with what we've got. Right. The very first thing we got to do is we got to test the people who are already working. We got 10 million people in healthcare who go into work every day and they don't know if they're infected. They don't know if they're a silent, asymptomatic carrier who's going to infect all their colleagues. We need to be able to test. And in healthcare, they're so exposed, we should be testing them every day. Same thing for police officers, EMTs, transit workers. Maybe you could test them twice a week. But you start to think this way, you're going to need 10, 15 million tests a day, even to do right by the people we're asking to do those jobs.
And we haven't even tested 1% of our population. We haven't even tested 3 million, and he's talking about 30 million. Here's the current data on testing. As you can see, we've tested so little, less than 1% of the country to see who has the virus. So we're still working on a test to reliably determine how many people have actually had this virus and if they also have some level of immunity from getting sick again. We don't even know for sure whether getting this virus gives you that immunity. Some scary stuff out of South Korea. Health officials there have seen indications that the virus can reactivate in some patients who thought they had gotten over it. Now, President Trump said the decision about when and how to reopen the economy is going to be perhaps the biggest decision he's ever made. That is something, and I think everybody would agree, is truthful there. To be sure, there are going to be enormous consequences, not just in terms of human lives, but also economically, socially, and politically. The federal government, in partnership with the states, doesn't get it right. it could be ugly for everybody.
Take me through what you and your colleagues reported late yesterday.
Yeah, well, what we're hearing about discussions inside the White House is that President Trump really would like to see the country begin opening back up for business on May 1st. Of course, he doesn't unilaterally control that, right? A lot of why the country is shut down now is because state governors have imposed orders that have legal force commanding residents to stay at home. President Trump and the CDC have just issued guidance. But it sounds like from these internal discussions, though the medical experts are wary of opening back up, Trump is really pushing them. And on his mind is sort of political and economic concerns. Some of the economic concerns, I'm sure, of course, many Americans share. But one of the things he has sort of privately complained about is that these sinking or, these dramatic unemployment numbers, the sinking stock market, that could really hurt his chances at re-election.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.
It will go away. Just stay calm. It will go away. A lot of people think that goes away in April with the heat, as the heat comes in. Typically, that will go away in April. We're in great shape, though. You treat this like a flu. 15 people out of billions of people. 15 people. Yeah. They're getting better, and soon they're all going to be better. Hopefully, it's going to disappear. One day, it's like a miracle. It will disappear. Now the Democrats are politicizing the coronavirus. You know that, right? Coronavirus. And this is their new hoax. So, healthy people, if you're healthy, you will probably go through a process and you'll be fine. You take a solid flu vaccine, you don't think that would have an impact or much of an impact on corona?
No. Probably not.
Mr. President, is it safe or appropriate to be holding rallies during a public health crisis like this?
I think it's very safe, yeah. I think it's very safe. Things are going very well, as you see.
Do you believe it's inevitable that the coronavirus will spread across the country?
No, I don't think that's inevitable at all.
We have a report today, the global death rate at 3.4%.
Well, I think the 3.4% is really a false number. Now, this is just my hunch. Personally, I would say the number is way under 1%.
At this moment, we think we have it very much in hand. It's going to all work out. Everybody has to be calm. It's all going to work out. It will end. People have to remain calm. Be calm. It's really working out, and a lot of good things are going to happen.
What do you say to Americans who are concerned that you're not taking this seriously enough and that some of your statements don't match what your health experts are saying?
That's CNN, fake news. This is just a temporary moment of time. We're in great shape compared to other places. We are in really good shape. And 5 million within a month, I doubt we'll need anywhere near that. As of this moment, we have 50 deaths, which is a lot of good decisions were made, or that number could be many times that. But it's something that we have tremendous control of.
And on a scale of 1 to 10, how would you rate your response to this crisis?
I'd rate it at 10. I think we've done a great job. And we're going to win. And I think we're going to win faster than people think, I hope. But we're going to defeat the invisible enemy. I think we're going to do it even faster than we thought. And it will be a complete victory. It'll be a total victory. Because people get better. I mean, most people are getting better. Most, by far, the people, you get better.
Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope?
No, I don't think so. Many doctors, and I've read many doctors, they can't believe the great job that we've done. Doing it the way we're doing it is much better. It's really much better. America will again and soon be open for business, very soon. We're near the end of our historic battle with the invisible enemy. I think it's ridiculous. We don't have to do it. A lot of those states could go back right now, and they probably will.
something important has happened over the course of this crisis. Estimates of expected deaths have gone down by a lot. On March 31st, the White House estimated that even with social distancing policies in place, between 100,000 and 240,000 Americans would die of COVID-19. Dr. Deborah Birx, the White House's coronavirus response coordinator, said that that was, quote, our real number. Dr. Anthony Fauci, the nation's top infectious disease expert, recently indicated he now believes it will be more like 60,000. The University of Washington model, which has been cited by the White House, predicted on March 26th that assuming social distancing policies that stay in place till June the 1st, U.S. deaths by August would most likely be around 81,000. By April 10th, they had made many revisions to get to their current number, 61,500. Predictions for hospitalization rates have also proven to be way too high. On March 30th, the University of Washington projected that California would need 4,800 beds on April 3rd. In fact, the state needed 2,200. The same model predicted that New York would need 58,000 beds on April 3rd. It used only 15,000. It made sense to take precautions, but that may have come at a cost, as there are concerns that patients with other conditions haven't gotten the care they need. So what is going on? Well, many experts believe that social distancing has worked even better than was predicted. But here's a theory, acknowledging we still don't know a lot about the virus. A group of Stanford scholars believe that the basic reason estimates of deaths have had to be revised downwards is because without an understanding of how the virus spreads and without widespread testing from the start, we didn't realize how many mild or asymptomatic cases that there would be. That means the denominator, those who have been infected, could be much larger than initial estimates, and therefore the fatality rate for COVID-19 is much lower. In March, the WHO announced that 3.4% of people with the virus had died from it. That would be an astonishingly high fatality rate. Fauci suggested a week later that the actual rate was probably 1%, which would still be 10 times as high as the flu. Since then, we have learned that many people, in some studies 50%, in some studies as much as 75 to 80%, don't have any symptoms. That means it's possible most people infected with the virus are not getting counted. Stanford's John Ioannidis believes that we have massively overestimated the fatality of COVID-19. He told me, when you have a model involving exponential growth, if you make a small mistake in the base numbers, you end up with a final number that could be off 10-fold, 30-fold, even 50-fold. He points out that in some of the places with the best testing, the Diamond Princess cruise ship, the Italian town of Vo Eugenio, Iceland, Denmark, the numbers who are actually infected when adjusted for the US population as a whole suggest a fatality rate that is actually similar to the seasonal flu. Based on limited testing data, he estimates that fewer than 40,000 US deaths will occur from COVID-19 this season. Now, that is still a tragedy, and we should be glad that the work that we've done to abide by social distancing has done some good, though it has come at a price, of course. That said, no one knows the right answers. That is why we need the best data, and that's why we need to hear both from the mainstream voices and from dissenting voices. We have shut down the economy based on models, which is understandable because we worry about worst-case scenarios. But in science, models evolve with new and better data. President Trump says we don't need mass testing, but reopening the economy will depend crucially on mass testing, or else once controls are relaxed, we might see the infection soar again. South Korea has been able to tackle the virus without major lockdowns, in large part because it has handled testing superbly. The most urgent task for the federal government is to get widespread randomized testing in place, gather the best data in the world, and make policy based on that. Otherwise, we will continue to fly blind through this crisis.